Hi, my name is Martin Cormack and I'm the HSE lead for antimicrobial resistance and infection control. I'm going to talk to you a little bit about how you use the personal protective equipment packs that you're going to get to reduce the risk of infection. So you will have received packs that look like this. There will be 4 per practice. I suggest that when you receive the packs that you take one of them and that you open it and that you make yourself familiar with the contents of the pack so that if you need to use them, you already know what the pieces are and that you have familiar with how to put them on. Okay, so these are the contents of the pack laid out, and you'll notice there is a gown, goggles, a mask, gloves, and a clinical waste bag, and most important, we have a product here, the hand gel, to decontaminate your hands. So the first step and the last step in almost anything to do about protecting yourself in infection control is to decontaminate your hands. So you use enough gel to wet all the surfaces of your hands, then up and down the back of the hand with the fingers blade so that you're cleaning in the space between the fingers. Then go back and make sure you've got the finger webs. Interlace your fingers to make sure you clean your fingertips. Then the thumb of both hands, and then clean the center of your palm of both hands. And that's your first and your last step in terms of protecting yourself against the risk of infection. Okay, the next thing that we're going to do now is that we're going to put on the gown. So here's the gown. We open it out. When you're putting on the personal protective equipment, it's worth saying that all of this is clean and safe. The reason you have to put this on in a particular way is to make it easy and safe to take it off. So if you make a mistake putting on the equipment, that's easy to fix and it's safe to fix because none of this is contaminated at this point. But you want to make sure that you put it on in a way that makes it easy and safe for you to take it off. So I'm tying the gown at the back. The next step then is putting on the mask. Now many of you will be very familiar with these masks from your days as a surgical intern or surgical nurse. So remember that the band part of it has to go on the top. So the first thing to check is that the band part is uppermost. And you put this over your face and you can shape the band around your nose and then bring the strings up and tie them at the top of your head. Like that. And this is the trickiest part perhaps of putting on the PPE, and if you do this properly, it makes it much easier to take it off. You'll see the strings have gone up in front of my ears, not behind the ears. And then we tie again at the top of the head. And then fit the mask to your face and make sure that it's under your chin. Now we have the mask in place. The next step is to put on the goggles. You'll notice that I'm wearing eyeglasses, but even with eyeglasses, you need to wear the goggles to give yourself adequate protection if there are splashes or droplets. And then the next step is putting on the gloves. Okay. So we put the gloves on, and again, remember at this stage, everything is clean and safe. And bring the glove up over the wrist to protect yourself as much as possible from the risk of contamination. Now at this stage I have the PPE on and I'm ready to go and see the patient, but there's one other step that we're going to do here, which is just preparing for the takeoff. Is when I go in to see the patient, I'm going to bring this clinical waste bag with me and just check that you have the clinical waste bag set up in a way that makes it easy for you to put stuff into it when you're finished. And now I'm ready to go and see the patient, and I can enter the room at this point safely and with adequate personal protective equipment. We're finishing the patient and we're going to start removing the PPE. And the first steps of removing the PPE will be done in the space where the patient is. So we start by removing the gloves. Now remember that where the virus is most likely to be is on my front. So on the front of the goggles, on the front of the mask, on the front of the gown, and on the palms of my hands. So the technique is about trying to avoid contact with those areas. So we start high up on the back with the glove, and we take it off without touching the front of the glove. And as I take it off, I rolled it like that
so that I'm only touching the inside. Now I take that into the palm of my hand here and I go high up on the back of the other side and put the finger inside, bring it down, and again I've rolled the glove so that anything that might be contaminated is now inside. The next step is to get the hand hygiene gel, and the key thing here is don't spare the gel. Put on enough of it to make sure that you can wet all the surfaces of your hands, as here, and then up and down on the back to the front. Make sure you've got the finger ribs. Interlace to clean your fingertips. Thumb, palm of the hand, palm of the hand. And now I've got my hands decontaminated. And now the next step is taking off the goggles. So if there's virus in the goggles, it's going to be on the front of the goggles. So where I touch is I touch at the back, where I can lift the goggles off without touching the front and put them into the waste. Now, the waste bag here is on a flat surface. In an ideal world, we would have this in a bin, would be much better. But in the practical world of general practice, you may not always have access to a proper bin holder. So what we have done here is we put it on a flat and cleanable surface. So when this is all over, we can clean and decontaminate that surface, and that manages the risk that's associated with that. Okay, so now we're going to take off the gown. So what we want to try to do is avoid touching the front of the gown as much as possible. So I loosen it at the back, release the Velcro fastener, and then we're going to try to avoid touching the outside of the gown, because that's where the virus is going to be if I have contamination. So we bring it forward without touching the outside of the gown, and then I can roll it up from the side that's not contaminated, and then I'm going to put that into the waste. When I'm leaving the patient's space, I'm going to bring the clinical waste bag with me, touching the outside of the bag, not the inside of the bag, because I don't want to contaminate my hands. And I'm going to take this outside of the space where I was with the patient. And I'm going to put the bag down on the surface, and I've got my alcohol hand gel here because I'm going to need that also. And I'm going to put the alcohol hand gel where I can reach it easily. Now, the way the mask was tied means that it's easy to take off. If there's virus on the mask, the virus is on the front of the mask. So that's what I don't want to touch. So I put my hand up high and catch the knot. Because of the way we put on the mask, it just falls forward. So without ever touching the outside of the mask, I can put it into the clinical waste. And then I take my hand gel and put on enough gel to wet all the surfaces of the hands. And again, it's the same drill as we've done before. Up and down on the palms, up and down on the back, making sure that the fingers are cleaned. Cleaning the finger webs, interlacing the fingers to make sure the fingertips are cleaned. Cleaning the thumb, cleaning the thumb, cleaning the palm of the hand, cleaning the palm of the hand. And now I've removed the personal protective equipment. What I now need to do is to get rid of everything is in the bag. So I can pick up the bag with everything inside, close the bag, and then for safety, you can put this bag inside another bag, into a double bag just for safety. And when everything is finished, the single most important thing when everything is finished is once again, is to decontaminate your hands. If you make any mistake at any step through the process of taking off the personal protective equipment, the final step that protects you against any mistake that you might have made is hand hygiene, the single most important step. So again, on with the gel, all over the surfaces, up and down, back of the hands, finger webs, interlace the fingers, thumb, palm of the hand, palm of the hand. And if I made any mistakes taking off the PPE, this is the thing that will kill or destroy any virus that's on my hand. And this is the final key step in protecting me against acquiring infection while I'm seeing the patient. So thank you very much for your time in watching the video. And if you follow the PPE as we've shown you, the use of the PPE as we've shown you, then the risk involved in seeing a patient is very, very low, a risk we can manage well using the PPE, and in particular being careful about hand hygiene. Thank you.